All right, so we're going to talk about the chest tube, just kind of a quick intro. How many of you have had chest tubes before? A patient with a chest tube, not you with a chest tube. One, okay. So we have a couple different kinds of devices, collection device. We call them Pleuravacs, mostly because the old brand was called Pleuravac. So just like nurses say Heplock when there's no heparin in it, we call this a Pleuravac, even though that's a brand name and this is an atrium. Okay? So you'll hear nurses calling it a Pleuravac. There's wet and dry suction, and you'll get to play with both in the lab next week. They really are not any different, except that wet suction, you hear the bubbling, and so as a nurse you feel like it's working. The dry suction, there's no sound when you have the suction on. And there should be pictures in your PowerPoints, or you can Google chest tube dry suction. And it'll have a big circle here, and then when you have suction, the little window fills with like a little red plastic thing, and then you know you have suction. And then you can turn it to whatever suction you want. So that's dry suction. But the mechanics and everything behind it are the same, okay? So you have to make sure you have sterile water, not normal saline, okay? This part you do not have to keep. I know we feel compelled to, you don't have to keep. It's the do not use if the seal is broken kind of a deal, right? The lid is underneath. I know, blowing everybody's mind.
Yeah, I'm like, why does it come off? I have to put 2 caps on, and I just kept doing it.
They want to make sure you know it hasn't been touched. The Pleuravac, when it comes out of the package, it's going to be wrapped in like the blue surgical stuff, and there's usually a stand underneath it, so it'll stand up. And a lot of times we'll tape it to the floor so you don't knock it over. What happens if you knock it over? Everything gets spilled and you got to get a new one. So 20 more minutes of your time at least, okay? On the back, all this tubing is kind of tucked into this little bag, and then there's a syringe that comes with it that someone has, oh there it is, a little syringe. It really doesn't matter, you don't need this. You can use it, it's fun, but you don't have to have it, okay? Just put that in there for you. And then there's also hangers at the top, so you can pull these up and hang them on the bed, okay? So that's how that works. On the front, no matter what kind of Pleuravac you have, you're going to have 3 sections, okay? So you're going to have the suction chamber, and most chest tubes are 20 centimeters of suction. If it's not 20 or gravity, you're going to question it. It shouldn't be 15, it shouldn't be 30. If it's not 20, you're going to go, hey doc, are you sure that's what you want? Okay? I've seen it once, I think, in my whole career. Somebody ordered 15. It's either 20 or gravity. Okay? And there's a line right here that says 20. If it's dry suction, then there's the circle window, and there's a red line that points to 20. Then you know you have 20 of suction. Okay? There's a water seal chamber. So think about if we put a tube in someone's chest and the tube is just hanging out. What's going to happen with air? Where does the air go? Because we're negative pressure, you're going to suck the air in, right? We don't want to suck the air in. Think about a gunshot wound or a sucking chest wound, things you've probably seen in the movies. You can Google and get all kinds of fantastic things online, sucking chest wounds. Just to get a visual that if I have a hole in me, I'm going to suck air in, and then it's going to get in the pleural space. I now have a pneumo, and my lung is going to collapse from all that air pressure, okay? So if I just have a tube sticking out, and I don't have it under something like underwater, I'm going to just suck air. If I were to put it in this bottle and put it underwater, it's going to then like be at equilibrium, and nothing's going to happen. I'm not going to suck anything in. Air might blow out, okay? But that's how the water seal works. So the water seal is this one in the middle, and there's a little line here as well that shows 2 centimeters, and that's the fill line. There's also a big blue arrow. Some of them have a red arrow. So you have to have that filled with sterile water at all times. And that's so you don't bring air back into that pleural space. Okay? The third area is the drainage area, and that's where anything that's coming out of the patient through the tube is going to drip into here.